part of the AUA curriculum, it isn't, there isn't a whole lot of actual content out there for us. So our efforts here at this, with this grant over the last 4 years have been to put together a curriculum that can be used by other programs around the country, and not necessarily just urology programs. Our efforts so far have been the Geriatric Urology Symposium 1, 2, and 3. And let's see if that opens. And you can find these if you go to Education and you come down to, where is it? It was there last night. It's got to get, it's probably down, no, it's contact information. Anyway, it's on the website. I can't get it to show up here right now, but it is on our website under Education. I don't know why we're not seeing it here. But it was there last night. But all three of these symposia so far have been videoed, and they're on the website. You can pull them up and watch them and watch the talks. There were various talks on things like cancer, anesthesia, geriatric anesthesia, and so forth. So there's a lot of things out there that will allow you to be up to date on your and now it doesn't want to go anywhere. There we go. So in keeping with the ACGME's requirement that we teach in the core competencies, today's effort is going to be on systems-based practice. And physicians have to understand in the overall context of the healthcare system in which our patients exist. It's really important to understand what's going to happen to that patient when he gets the bill, or how he's going to pay for his health care, or how the system actually keeps that patient healthy. So we're going to discuss several different areas in that aspect. You also have to remember that the patient's financial health plays a huge part for all health and people. Ignore that when you're ordering tests or ordering surgeries at various places. You can get your patient into quite a bit of trouble if you don't understand his overall healthcare situation. So systems-based practice, we're required to demonstrate an awareness of and responsiveness to the larger context and system of healthcare, and demonstrate the ability to effectively call on the system resources to provide the care that's of optimal value. And the latter part is what we're about today. First of all, you have to know what the system is. Second of all, you have to know how to use the system. So we're going to discuss a bit about the healthcare systems that are available to our patients, not just the geriatric patients, by the way, but we're going to expand this beyond it. Hopefully we'll be able to appreciate some of the nuances of the recent healthcare law changes and develop ideas regarding the future direction of healthcare provision in Texas and the United States. So today's, without further ado, this is our agenda for today. Dr. McWilliams, who most of you know already as the director of CareLink, and has been at the University Hospital for a number of years, since 2007, I believe, right? 1998, same year as I came here. He's going to talk to us about state and county-sponsored programs, specifically about CareLink. Ms. Jackie Cooper, Dr. Cooper is going to, and her team is going to talk about Medicaid and how it relates to our patients. Then Dr. McWilliams is going to talk again about Medicare. At lunchtime, we will have lunch served in this room, and we'll have a panel with Dr. Holt and Ms. Fontenot, I guess it is, about current healthcare issues. And I think they're going to be speaking specifically about the physician shortage and how it's being dealt with. And we'll talk about private healthcare insurance, and then end-of-life care in the afternoon. And then